Hi guys, it's Miss Maddock here, and today I'm going to talk about antipsychotics. You may have came across antipsychotics on your psychiatry placement in patients with schizophrenia, but antipsychotics are also used in the general ward setting to relieve acute agitation in some patients. They tend to be divided into typical and atypical. An example of a typical or first-generation antipsychotic is haloperidol. Atypical or second-generation antipsychotics include olanzapine and risperidone. And the big difference between typical and atypical antipsychotics is that atypical antipsychotics produce less extrapyramidal side effects. So, what are these extrapyramidal side effects, and why are they so bad that we tend to use atypical antipsychotics? Extrapyramidal side effects include Parkinsonism, and this is basically when patients get symptoms such as shuffling gait, tremor, and rigidity. They don't have Parkinson's disease, but they have Parkinsonism, which is secondary to antipsychotic drug use. Patients can also get akaphasia, and this is a feeling of internal restlessness. This can be managed by reducing the patient's dose and placing them on propranolol. Dystonia is another extrapyramidal side effect, and it can occur within days of taking an antipsychotic medication. And dystonia is basically spasm of the muscles, and these muscle groups affected include the eyes, the jaw, and the neck. Tardive dyskinesia is the fourth extrapyramidal side effect that can occur. It is a very late side effect, and what it basically is abnormal involuntary movements, and the danger of this is that it is irreversible. Patients can have chewing movements with their jaw and similar facial movements. For this reason, we normally try to avoid using the typical antipsychotics, as they are more associated with these extrapyramidal side effects. So atypical antipsychotics tend to be used in preference and are first line for schizophrenia. The one time you may see the typical antipsychotics being used is in acute agitation, where haloperidol is typically given. There are also common side effects of all antipsychotics, and these include drowsiness and hypotension. You should also notify patients starting antipsychotics of neuroleptic malignant syndrome. This is a rare condition, but it is important to be aware of it, as it has a 10% mortality, and it occurs within the first 10 days after starting treatment, so it's a relatively early side effect to occur if it is going to occur. The patient will have a fever, rigid muscles, confusion, tachycardia, and a fluctuating blood pressure, so it may be high and then low. If this is suspected, we typically test for creatinine kinase and LFTs, and for this reason it is useful to have these tests done as a baseline before starting antipsychotics. Antipsychotics also require some monitoring, and this includes routine blood. So if you're starting someone on an antipsychotic, you should do an FBC, LFT, and urine, basically your routine bloods. Patients will also require fasting blood glucose and fasting lipids. prior to treatment and 3 months after treatment, and annually. As antipsychotics are associated with weight gain, it is important too to get the patient's BMI and waist size before starting treatment. Antipsychotics are also associated with significant cardiovascular risk, so blood pressure and pulse should be taken prior to treatment. Antipsychotics are associated with prolongation of the QT interval, so patients should all have a baseline ECG performed. Patients should also be warned about the dangers of suddenly stopping antipsychotics. It is very important to withdraw slowly, as rebound psychosis can occur. This concludes my video on antipsychotics. Thank you very much for listening. I hope you enjoyed the video, and if you did, please don't forget to hit the like button and subscribe to my channel for more medical education videos.